Thank you for joining our Accepted Students Week. My name is Gary Wilson. I'm with the admissions team here. More than happy to present this presentation on our health sciences program here at MCPHS. I'm joined today by Dr. Robin Harvin and one of our students, whose name is Nishita. We'll be going through a couple of questions to talk about the health sciences program. The first one's coming to you, Dr. Harvin. Could you please describe the strengths of the program that make it the best choice for students?
Sure, thank you so much. Welcome, and thank you for being here with us to hear about the health sciences programs and pathways. Let me tell you a bit. I'm the director of the health sciences programs and pathways and a full professor at MCPHS University. And let me tell you a bit about the strengths then of all of the different options that are available to students with regards to pathways in health sciences. So primarily, we do have what are called accelerated dual degree programs. And those are for students who already have in mind a particular health career pathway they're interested in. So by way of example, and Nishita can certainly speak to this one, we have a doctorate in physical therapy pathway. So it's possible to be able to receive a dual degree with a bachelor's degree in health sciences, and the fourth year, I should say, of the program of study in health sciences double counts as the first year in the physical therapy program, the doctorate in physical therapy program. So rather than being what most institutions are, which is a 4+3 year sequence of degrees to be able to become a doctor of physical therapy, ours is a 3+3. So that's a very good example then of our accelerated pathways. We also have the Master's in Occupational Therapy pathway. The fourth year of health sciences double counts as the first year toward the Master's in Occupational Therapy, moving on to our Manchester campus from the Boston campus. And then we also have the dual degree in the Master's of Acupuncture. So if you have interested in acupuncture or in Oriental medicine and acupuncture, this is another possibility through our New England School of Acupuncture. So the first 3 years toward the Bachelor's of Health Sciences, and then that fourth year double counts toward the first year of a Master's in Acupuncture or a Master's in Oriental Medicine and Acupuncture. And then we too have two other pathways, which are dual degrees in bachelor's degree programs. So we have one, which is a dual degree program in Bachelor of Health Sciences in Dental Hygiene. So it's possible for those who wish to become leaders in the dental hygiene profession, are interested in moving on, for example, in their future to a master's degree program, this is a good choice. So you could be able to get a bachelor's in health sciences your first 3 years, and then your fourth year double counts as your first year just on the registration in dental hygiene. And then you can go on to a master's in dental hygiene from there in a variety of different ones. The same we have in nursing. And this is particularly helpful for students who are interested in becoming nurse practitioners rather than registered nurses only. So if you're interested in becoming a nurse practitioner, this is a good option because you can have the bachelor's in health sciences, 3 years. Your fourth year of health sciences double counts then as your first year of the registered nursing 16-month program. And then you move on to a master's in any of our nurse practitioner programs. So those are very good accelerated options. We then have as well, if you're interested in becoming a health educator, we do prepare you to become a health educator and sit for the registration exam as a certified health educator. A health educator, a certified health educator, intervenes and provides interventions and treatment with education and promotion. And there are a multitude of jobs. Just before I came online here today to talk with you, I wanted to see how many jobs there were. And they're just in the Boston area alone, 280 jobs today for certified health educators. So it is a very growing field that has a lot of need. to be able to help people with their lifestyle and how lifestyle medicine does apply to achieving better health outcomes. We have the general concentration for all of you who would like to career explore. So I like this one as well, because this is a very good option for those who are interested in a health career, but don't know. I don't know really what I want to commit to. So this is a good choice because this is a springboard then for any of the programs that we have at MCPHS, because we introduce you to the different careers that you might have, and we help you with thinking about coming into health sciences and springboarding then to any of the other programs. We do provide strength individualized career counseling then. We provide flexible curricula with full-time, part-time, depending on what you'd like. I think, it would be a good choice, especially if you know where you want to go. And even if you don't, you have the opportunity to do career exploration.
Wonderful. So Nishita, why did you choose MCPHS?
So a bunch of reasons. My biggest reason would be definitely the 3+2 pathway, because I was so sure that I wanted to get into PT. I just wasn't sure what direction exactly I wanted to take it, but I was sure I wanted to do something in it. And the 3+2 pathway is so beneficial. It's also like you get your undergrad degree, and then before you're done, you're also working towards your graduate degree. You're doing your doctorate in the PT, and it saves like one whole year, which you can go out in the field and get a lot of experience in. Also, definitely the first 3 years you're in Boston, which has a lot of opportunity for like healthcare in general. So like you can learn more about other professions. You can do a lot of volunteering, job opportunities. There's so much extracurricular activities because we're surrounded by college students. So there's a lot of room for all that. And also definitely like how we have like the clinical programs and the simulation labs at the Worcester campus, because I've also heard like we have the full-time clinicals, which means you probably have like a mini semester, which is not maybe one class, and then you're doing like hands-on experience the rest of the time. So all those were like my biggest factors that I chose MCPHS.
Awesome. Thank you very much. So Dr. Harvin, back to you. What do you enjoy most about teaching at MCPHS?
The focus on teaching. I've had a long career in health professions education, 30 plus years of teaching at places like Rutgers University, University of Colorado, and now at MCPHS for the last 8 years. What I really appreciate is the primary focus on healthcare, whereas Rutgers and University of Colorado had many different schools and programs on large campuses. This is devoted to health careers and devoted to health professions education. We're all on the same page. We're all focused on the same mission. We're all focused on the same goals, the same vision, and we're very focused on teaching. So my faculty workload is 60% teaching, which is a lot for an administrator. 20% is being a program director, as well as I chair the Interprofessional Education Committee on the Boston campus and the Interprofessional Education Committee in the School of Arts and Sciences, and that's my service. And then my 20% is my scholarship. I still do research and publish, sit on journal review boards, etc. Receive grants, and I'm on a grant currently. But that's not my primary focus, as many faculty are on the larger campuses. So it really is that focus on student-centered teaching and student-centered support that I appreciate the most.
That's absolutely wonderful to hear. Now, Nishita, back to you. You had mentioned before some of your outside the classroom experiences. So can you expand a little bit on the ones that you're involved in, and how you feel they're going to help you in your future?
Definitely. So, like I said, there's like a lot of scope to do stuff around Boston. So in school, I'm actually at Brainsa. I work as a student leader. I worked as an orientation leader, which is really rewarding for me. It actually really helped me like grow myself. And then outside school, alongside all of this, I've done a lot of job shadowing. So one thing for me was I really, I, I had an idea I wanted to do PT, but I wasn't sure exactly what that meant. So, and around Boston, there's so many clinics just centered around PT, patient clinics. There's also like opportunities to volunteer and job shadow at hospitals, but I wanted to focus on clinics. So that's what I did. And I know my friends, a lot of them, they have like solid volunteering jobs around like Brigham and Women, Boston Children's, and a bunch of Mass General. They have so many like other outside extracurriculars. So that's really helpful. And so at job shadowing, I get to really learn exactly what I'm going to be doing after I graduate. Like definitely I'll have like probably a different direction, but that's like the basis of what I'm going to be doing. And after, say, for graduation, I graduate in 2022 with my Bachelor of Science in Health Sciences, and I come back in the summer to continue with my second year for the DPT program. So I did plan initially on working as a PTA or like doing kind of like an internship at any clinic while when I graduate. But I've also learned like there's a lot of course load. So depending on what I'm most comfortable with, I'll just like probably finish my 3 years for the DPT as well. And then I'll probably start working at a clinic initially. And then I want to move like wherever I feel I want to go. So that's
Wonderful. So Dr. Harbin, can you provide some examples of accomplishments, appointments, and accolades for faculty within the health sciences program?
Well, in general, I would say that that's another reason why I really enjoy being at MCPHS is not only that focus on being student-centered, but the faculty community that I work with. Really exceptional reputation of our faculty. So it's wonderful to be able to collaborate with faculty at MCPHS, but also faculty within that Longwood medical area as well. So in addition to having a faculty appointment as a full professor at the School of Arts and Sciences at MCPHS, I also have a faculty appointment at Harvard University in the School of Medicine and in the School of Dentistry, because I do scholarship and research with them as well. So I do have a faculty appointment in which I serve as the lead evaluator for the Center for Primary Care in the School of Medicine, and I serve as lead evaluator at Harvard's School of Dental Medicine in their Center for Integration of Oral Health and Primary Care. So that's pretty exciting. I've been privileged to be able to have a very long career, and in doing so, privileged with receiving a few awards. And those awards, the most prestigious are the fellowships. I was given a fellowship through the American Council of Education, and this is the premier organization that supports presidents and provosts across the country in higher education. And I was a fellow in the early 90s, inducted as a fellow. I was inducted as a fellow since I've been at MCPHS with the International Association of Medical Science Educators. And I just received last year an honorary fellowship with the National Academy of Practice, which is through the National Academy of Medicine and Healthcare. So those are pretty prestigious. Very pleased that another faculty member has joined the health sciences, and that's Dr. Anthony Lucina. He is an instructor in the program. He also helps with advising. We have 160 students across all of the different pathways and programs. And Dr. Lucina and I provide then the faculty mentoring to all 160 students. So we divide them up. So that's an important piece. And Dr. Lucina is focused on the health educator track in particular, because he does have a master's degree in health education. He has a doctorate in health sciences leadership, which he received from MCPHS University, as well as he is a certified health educator and can help then with the certification process. And our graduates are very successful in becoming certified.
Wonderful, and congratulations on your most recent award.
Thank you.
So one final question for you, Nishita. Is there any advice you could offer prospective students who are currently watching?
Yeah, definitely my biggest advice would be don't stress. Don't worry, don't stress, because that was my major concern. I stressed too much. I thought so much about it, but it's gonna happen. It's gonna take its time. It's gonna happen. Everything designed here is to help you succeed. There's nothing that's gonna stop you from it, and it's just gonna take you in a different direction, if nothing. But do not stress about it. Just enjoy your time, even before you start college and after you start college, because it's gonna be a really fun experience.
Thank you. And one final question for you, Dr. Harvin. So you've spoken a little bit about the opportunities and tracks within the health science program.
Yes.
Can you share some examples of student outcomes?
Yes. And exciting, I think, because one of the things we've certainly seen is for students who are interested in moving on to the graduate programs, their grade point average is important, right? The grades. And what we have seen is that the graduating GPA of health sciences students over the last 8 years has increased exponentially. So that means the program's doing well in being able to support and prepare students to academically succeed. If their GPA over time, graduates are doing better and better. Graduate program acceptance rates are also exceptional. Students like Nishita, who are interested in those pathways and moving on and applying to those baccalaureate programs and post-grad programs, are being successful in getting into those programs as long as they maintain that GPA. So they maintain the GPA, you know that you have a better chance of being able to move on. At MCPHS, and there are students who move on to other institutions and different kinds of professions, such as medical school, by way of example, and have been successful. Program transfer rates, very exceptional. Students who come in, for example, they were thinking about going into nursing, they're not sure, or maybe it was full, they come into health sciences, they are successful then after that first year to get into the nursing program, to get into another. So we do have a good rate of being able to retain students at MCPHS, even if they switch programs along the way. They can also go from pharmacy to health sciences. And some students say, you know what, I'm not sure I want to become a pharmacist anymore. Dr. Harvin, can you help us help me with thinking about a different path? Employment rates are exceptional. We have students that are employed and working a lot in the Boston metro area, even along the Longwood Medical Campus in Boston. And the graduate survey accolades are appreciated, because we do graduate surveys every year, and what they do say about the health sciences program are positive.
Wonderful. And is there any final thing you would like to say to prospective students watching?
Which certainly is, if you have any questions, to be sure to contact the admissions office and speak to one of the admissions officers about health sciences. They can also connect you to me directly as the program director for health sciences to be able to answer any questions that you might have as well. So hope to see you in the future.
Thank you both so much for coming and speaking with our students, and to everyone watching, congratulations again, and we look forward to seeing you very soon.